I think it's still early enough to wish everybody a Happy New Year and hope people have had a good Christmas. I do apologise for the heating. I just wonder if some overzealous person has perhaps knocked the heating down a little to save money. Some people have a track record for that. I'm not mentioning any names. But I think it can perhaps concentrate our minds not to be too long-winded today to try and get warm. Can we have no apologies, minutes, can we agree them? And if, just another couple of announcements. Can we just congratulate the gritting team? I know it's not been too bad, it was a short spell. But they go over and above. I mean, they do a day's work and then they're out all night gritting. And, you know, we really should acknowledge what they do. And also, our bin collection, we haven't missed a bin over the Christmas period. And in some areas, it's quite chaotic. So I do feel that we should mention to the bin collectors, you know, how impressed we are with that the bins are moving forward. We haven't any items of urgency. Can I draw members' attention to item 5, declaration, etc. And then we go on to the key reports. The item 6, adult and social care health strategy. Before I bring Michelle in, can I just say this report is so impressive how it's been presented and put forward. I really think some good work has gone into this. Michelle.
Yeah, so the purpose of this report is to present the adults and health strategy for approval. With the expiry of the current strategy, as a directorate we have developed the adult and health strategy. It sets out our vision and ambitions over the next 4 years, and it focuses on improving health and well-being by providing that targeted support, having those collaborative approaches and harnessing local assets alongside our own individual strength. The strategy has been co-produced with our workforce, our partners and people with lived experience to develop meaningful ambitions over the next 4 years. As part of the consultation, the new Adults and Health vision is your health, your well-being and your independence. So as you can see from the report, it sets out lots of ambitions and goals leading up to 2030. So with that, I ask that Cabinet approve this strategy and the associated achievements that are set out within it.
Thanks, Michelle. Any questions, any comments? George?
Yeah, I welcome the report, Leader. I think it's really a really positive approach that the council's taking up to 2030 as well and beyond. And I like how it's been done with those that needed it the most. So the consultations really helped it move forward positively.
Yeah, echoing some of what George has said, but I think it's really important after the launch of the district plan that we're continuing that collaborative approach, making sure partners are around the table and we can really hold the feet of all of us to the fire to ensure that we're getting the outcomes that the people of the district deserve.
But yeah, and I think it's absolutely right that we've had everyone around the table and those with lived experience, those people that are going to be using our services have a right to be involved in the production of them. I think it's really positive, and I think we should thank officers for all the work that's been done on this to get it over the line, to give us this such an ambitious set of achievements to reach towards 2030 with.
Okay, so with that, can we agree the report?
Agreed.
Thank you very much. Item 7 is the initial revenue budget proposals for 26-27. I'd just like to say a few words. This paper sets out the financial context following the Chancellor's budget statement and the provisional local government settlement, which was published by the government just before Christmas. It covers how we're intending to respond, including to meet a 23.4 million budget challenge while still delivering strongly on our priorities for our residents. We're an experienced leadership team running this council. The continuing difficult financial picture across local government makes that more important than ever. It's no time for novices at the moment. That picture has really been highlighted over the last couple of weeks. We've been very reliable frontline services that have continued to perform well in Wakefield during the recent cold weather. as I mentioned earlier, including our bin collections over the Christmas period. By comparison, some other places have descended into chaos. People need to be aware of what is at stake this year and not put vital services at risk by taking a gamble. Our responsible and long-term leadership means we are able to produce a balanced approach to our budget setting process this year. We're investing significant amounts, almost 21 million extra in 26-27 in essential local services, including to meet growing demand for adult and social care and to give young people the best start in life. We're continuing to make more efficient and provide the best value for money we can. This will see us make 11.5 million of savings next year, as outlined in Appendix 2 of the report. And we're also looking at ways to raise more income to invest in frontline services, with 2.2 million expected from housing and business growth, and a combined 4.9 increase in council tax, including the adult and social care precept, next year will raise 9.7 million. The increase in council tax is in line with what nearly every council in this country will be doing, including councils run by Reform and the Conservatives. The national funding arrangements for local government assume it's what councils will do, irrespective of which political party runs them. We're a well-run council and stable council. As you can see from the chaos in other parts of the country, that's not something that people should take for granted. Our work means that Wakefield is almost certain to continue to have one of the lowest council tax in West Yorkshire after our budget is set. We never take the decision to increase council tax lightly. It's only after we have exhausted all other options. But we can only protect our frontline services if we have this extra funding. Anybody who tells you they can do something different without decimating our public services is being deeply irresponsible and gambling with the future of this district. Elsewhere in the country, some councils have taken that risk. It always leads to services being slashed to the bone, much higher council tax rises in the long term, and the most vulnerable in local communities suffering the most. This Cabinet will never take the risk with Wakefield's future. Residents can count on us to focus on what's important to their local communities. With that long-term approach in mind, the report also sets out sustainable approaches to our reserves, our schools budget and our capital programme. The proposals are now open to consultation until the beginning of February the 1st. I'd encourage everyone to have their say via the budget survey, which you can find on our website. The plans will then come back to Cabinet in February and go to Budget Council for consideration on the 2nd of March. These proposals are about focusing on what's important to you: reliable bin collections, improving roads and filling potholes, and tackling antisocial behaviour, creating better parks and green spaces, boosting our high streets and local businesses, and supporting our most vulnerable young and older people. Our experienced leadership team means we can continue to deliver on these things for our communities. And with that, I'd like to move this report and ask Cabinet colleagues if there's anything that they would like to add or include in what I've said. Jack.
Thank you, Leader. Yeah, I fully support the initial budget proposals going forward for consultation. I think, as you've said, Leader, the settlement from government is a modest improvement and the 3-year settlement is particularly welcome. But local councils continue to face massive pressures across the country, and Wakefield is not immune to this. The challenge, as always, is to balance these pressures while protecting frontline services that the public rely on. And I'm pleased that we've been able to do that in the draft proposals set out in 73 and 75 pages of this report. Anyone reading the proposals will note that other than the extra 14 million pressure from inflation, the standout issue for our council and our district is the increasing cost of social care for adults and children. This is the most important duty of a council in many respects, and it's forecast to rise by 20.9 million this year. This is unavoidable in terms of more cases, more complex cases, more costly care packages. It's something we absolutely have to fund to ensure that vulnerable residents who need us aren't let down. This is the reality of local government. Difficult choices have to be made, and as a leader has said, despite what some might say, there are no easy answers to this. That's why we're seeing councils of all political colours proposing to put up council tax, be it Tory, Labour, Liberal, and yes, all 12 councils run by Reform who are putting up council tax despite promising not to. Their local doge has completely failed elsewhere because local government has already been cut to the bone. The truth is there are a few efficiencies left to be made, just officers working hard, trying to do more with less for our communities. Where efficiencies can be made, we are making them, of course, and nobody wants to propose putting council tax up. But without generating that extra income, some services would have to cease. We have to be honest about that. And Wakefield will still have the lowest council tax in West Yorkshire, as set out on agenda page 56. These proposals are balanced. They will enable us to keep doing the basics well and to keep investing millions in communities. We've been open about the scale of the challenge, and I'm sure we all await the feedback and results of the public consultation with interest. Thank you, Leader.
Thank you, Chair. Mercy.
You are right to mention the chaos of Reform, Leader. When we've seen them come in last year and the resignations and everything else, but now all their councils are putting up council tax because they know there's no other way to do that. To run services properly, they have to do that, the same as all councils of political colours up and down the country. But I say this every year, and I make no apologies for saying it again, because I think it's a valid point. If you want to change society, give it to local government to do that, because we're the ones that can do it. It's tangible to local people. Cleaning the roads, repairing the roads, looking after people, it's what local government does. People don't go to the Ministry of Transport to report a road, they come to local government. They don't go to the Department of Health for social care, they come to local government. Give us the money to be able to do the work that we need to do to change people's lives. That's all I ever ask of any any government in power. That's what we need to have. Properly funded services that actually do affect people and change people.
I'm not saying that's very true. And I think, we would have hoped this time, yes, we've got a 3-year settlement, but the settlement hasn't been brilliant for us. And I wonder sometimes if any government understands the pressure that local government are under. Sometimes we just feel like the poor relation and the outfit, and yet we're the people that everyone comes to when they need some help. George?
Yeah, thank you. And testament to Wakefield Council over previous years as well. On agenda page 47, 1.11, it says that the future financial environment for local authorities remains extremely challenging. In the past 2 years, around 50 councils out of 317 have required emergency financial support from central government, with government forecasting this could rise to 100. Within West Yorkshire region, both Leeds and Bradford are in receipt of this. And we haven't, and it's been well managed. And I think that's the point, is that those that have a massive burden now for future generations to pay back, because that's not free money. They've got to pay that back. So in that respect, we've been doing things right through previous governments that have cut council settlements to the bone, like Matthew says. But going forward, and touching on what Councillor Morley's just said, is that we all live in the district. We're just normal people, but we've been elected to this post to improve where we live, and we need better settlements going forward. So in a way, it's disappointing that the settlement isn't where we are, so we can say that we've reduced the amount of money that we want to put up council tax by, because we are living in a cost of living crisis, and this is adding to that burden. But this report does set out real ambitions for what we want to do and what we want to improve in Wakefield District, the towns and the villages that we're representing. But yeah, it is disappointing that some councils have been rewarded in a way for being free and loose with the financial aspects of it, and we haven't. But going forward, we need better settlements, because this is what we need to do to improve and make those decisions going forward.
Thank you, George. Michelle?
Yeah, I think the report in itself is a testament to the work that this council has done. You're right, George, that we have been frugal with the money. We have looked at the budgets, we've looked at any efficiencies we could make and how we can work smarter and harder to make those savings, so that we're able to protect and not necessarily put things up, because none of us sat here come to council. We don't get elected as councillors with a view of, oh, I'm going to be a councillor and raise council tax. It's just not what we're in it for. But I think we need to be very clear that the choice is stark. We have a statutory responsibility to look after our most vulnerable people in this district, and the demand for that is astronomical. We're in a place that we need to look after people, and to do that we have to make some really difficult decisions. I think you will see in the report we are doing that. We're delivering the best we can. We're making efficiencies. Within adult social care, we're trying our best, we've seen in the health strategy, to make sure that people can live healthier lives for longer and they don't necessarily need that statutory intervention. But ultimately, people that need care, people that need support, need care and support, and we can't navigate around that. That is their right to get it. I think what's really positive is that whilst we're still protecting and providing those services, we still investing in communities. You can see some of the investment, some of the ways in which we work more smartly around attracting them opportunities so that we can still provide and invest in our communities. And I think it's a difficult decision. It's not anything that any one of us take any joy from, but it is what we need to do to protect those most vulnerable in our district.
Okay, anyone else? Okay. Support the report.
Agreed.
Thanks very much. David, the council tax discount.
Yes, thank you, Leader. I'm really pleased to introduce this report. It puts into effect a motion that Councillor Wilton and myself put to Council last year, and it provides that anyone with a terminal illness assessed by a relevant health professional is likely to pass in the next 12 months won't have to pay council tax, and that their family won't have to pay it for the next 2 months. This is in response to the Marie Curie Cancer Care campaign, Dying in Poverty, which highlighted that a significant proportion of people living with a terminal illness also live with money worries. By doing this, we are helping as much as we can to reduce those worries. I do need to address one point that has been raised with us, that we are doing it for everyone rather than means testing it. We accept that some people may get pension or insurance payouts on getting such a diagnosis, but almost everyone faces increased costs. And we didn't want people coming to terms with a really serious diagnosis, all its consequences, thinking, do I qualify, do I not, should I apply, etc. And having to fill complex forms in. So what we've done is this is tied to the SR1 form, which is a sort of standard passport for people through the benefits system when they're in this situation. And it is a simple scheme. The provisional costings are quite high, as we've never done this before. So I suspect it will come down in the future because not everyone will claim. I'd encourage everybody to claim, but not everybody will. And some people will be already in receipt of some sort of discount on the council tax. So with that, I move option 2, and through it hope that the lives of around 340 families are going to be less stressful at this most difficult time.
Thank you for that, David. It's an excellent report, and it's a good thing that we're doing. People, as soon as they get the diagnosis for that, it's devastating, and if we can help in any way, I think it's the right thing that we're doing. Anyone want to comment, Dan?
Yeah, just quickly to say, Leader, when we took this through the council, when we put the motion to council, myself and Councillor Pickersgill, what was fantastic to see was everybody come together to get behind such an issue, and as we said, it will really make a difference. The next step is about shouting about it and making sure families know that we're there to support them when the worst happens.
Yeah. Okay, can we agree the report?
Okay.
Thanks very much. Thanks very much, everybody. Let's go and get warm.